Welcome to Build Your Village, a fireside chat centering African American mothers and families. We hope that this information is going to be a blessing to you and those around you. Take this information, use it to build community, use it to build and grow and help others. We thank you for being here. I'm Dr. Joanne Michelle Martin, pelvic floor physical therapist and birth doula. Enjoy. Hello and welcome back to another episode. I am Dr. Joanne Michelle Martin, pelvic floor therapist, birth doula, and I am here with Ifeyinwa Asiodu talking about Black maternal health and more specifically the intersection of human milk feeding and Black maternal health. And I'm really excited to dive into this episode. Just a little bit of background. She's an associate professor in the Department of Family Healthcare Nursing at the University of California, San Francisco, and leads the motivating interdisciplinary lactation knowledge, or the MILK research lab. She's public health focused. She's a nurse scientist, educator, lactation consultant. Sounds like an all-around rock star. Her program of research focuses on identifying and addressing the impact of social and structural determinants of health during the reproductive life course, with specific emphasis on human milk feeding. She has completed postdoctoral work at the University of Illinois at Chicago as well. And she received her PhD from University of San Francisco School of Nursing. So she's doing amazing work in the community. I don't even want to draw it out any longer. Welcome to this interview. Welcome to this program, these fireside chats. And thank you so much for taking the time to be here. Just to get started, tell us a little bit more about you, and what you're doing specifically with the Milk Research Lab in the San Francisco area and beyond.
Hi, good morning, Dr. Martin, and thank you for the invitation to be here. A little bit more about myself. As you mentioned, I am an associate professor in the Department of Family Healthcare Nursing at the University of California, San Francisco. There at the there in the School of Nursing. There I teach within, I sit within, I should say, the midwifery specialty, but I primarily teach in the doctoral program and mentor and advise master's and PhD students, in addition to doing research. And as you mentioned, my work primarily focuses on addressing and identifying the systemic and structural and social determinants of health as they relate to human milk feeding and lactation inequities across the reproductive life course. So we conduct qualitative, mixed methods type research, in addition to creating resources and moving towards a more intervention work to really make a difference, and to ensure that, for me, all Black women and birthing people and their families have access to high quality human milk feeding and lactation resources and are able to make informed infant feeding decisions, ultimately with the goal to improve maternal and infant health.
Wonderful, wonderful. What are you, when we talk about human feeding, breastfeeding, chest feeding, what are you typically finding in terms of the likelihood that people are going to do so within your specific community and then within areas beyond that? Because we know that even though there has been a push to encourage individuals to breastfeed, chest feed, or to encourage human milk feeding, how often is that happening? And is it happening as often as we would like?
Yeah, no, that's a great question. I think it's important to note that around 83 to 85% of women who give birth in the United States initiate breastfeeding, right? And that's per the most recent CDC report card. I could be off a little bit on that percentage, but a high 80-something% of individuals are initiating breastfeeding. So we know that there's a high interest and intention. So it isn't an issue from my perspective in terms of individuals and families not wanting to. It's more thinking about what are the systemic and structural barriers that prevent individuals and families from meeting those goals. Here in California, we know with the MIHA data, the maternal and infant health assessment data, we know that there are high intentions when we look across race, ethnicity, high intention of individuals during their pregnancy saying that they want to provide human milk for their infants after birth. However, that intention isn't always able to transition to practice for a number of reasons. Some lack the education and resources and the maternity care practices and the perinatal care practices that are supportive of lactation in their communities. So less likely to have access to healthcare providers and lactation support providers who actually talk about and discuss human milk feeding and lactation and provide that anticipatory guidance during pregnancy, which is really important. Waiting until someone gives birth to talk to them about human milk feeding and lactation is a little too late, right? We really need to be having those discussions prior to pregnancy, during pregnancy, so that folks really start to put together their communities of support and resources and know where those individuals and groups are. So if they do encounter challenges or issues after they give birth, they know where to go. And we know that that first few weeks after someone gives birth is challenging. It's stressful time. You're learning yourself and your baby. You're in pain and discomfort. And there may be some health challenges that folks are dealing with either for themselves or their infant, right? So there are a number of different issues that folks are dealing with, in addition to maybe not having paid family leave. We know, unfortunately, about 25%, 1 in 4 of women who give birth in the United States has to go back to work within 12 to 14 days and 2 weeks. So if your main goal is, I need to go back to work, you're probably going to be prioritizing other type of activities to prepare to go back to work, childcare, things of that nature. And human milk lactating may not be a high priority. We also know the importance of lactation accommodation. Not everyone has lactation accommodations in their workplace or when they go back to school and things of that nature. Fortunately, we just had the Pump Act that was passed that ensures lactating people have access to break time to be able to pump. However, we need to make sure that that legislation is enforced, and that individuals know their rights, and so that they're able to utilize them. So unfortunately, it goes on and on and on, and we know, and when we think about systemic barriers, the issues of racism and bias also play a significant role for our Black, Indigenous, Latinx, and other racially minoritized women and birthing people. And so it isn't just are individuals able to breastfeed or chest feed or pump. It's much more of a systematic and structural and societal issue than just on that individual and or even on the family.
Yeah. And I love the way that you answered that, and I think that it is important for everyone listening, to hear this and to share this. If your goal, if your desire is to breastfeed, you need to start planning ahead of time. We can't wait until the baby is here. We can't wait until, we're in those first several days postpartum. We have to plan ahead of time. And I think that is so crucial. And that is something that is very much lost in prenatal planning and within our society in general. So thank you so much for saying that. When it comes to human milk feeding, we know that not everyone, for a number of reasons, are going to be able to have an infant that latches. We know that everyone will not have maybe ideal milk production. And we know that there's circumstances, like you mentioned, early return to work that may inhibit, even if they had the desire, may prohibit them from being able to do so. What do you find as far as opportunities for donor milk within communities, whether it be moms are having issues or persons are having issues with lactation or are just producing milk, or we have infants that may have been premature, they're having to spend time in the NICU, or they may have other medical concerns.
Yeah, no, I think that is an important point to consider. While of course we want to advocate for human milk feeding and lactation, also making space for, as you mentioned, the possibility that that may not be an option for an individual or family. And so making space for different types of infant feeding journeys. Ones that include, as you mentioned, donor human milk. They may include formula, also milk sharing, community milk sharing. And so I think, again, with donor human milk, we need to do a better job of increasing awareness about donor human milk, the process of donor human milk, in addition to increasing access. We did here at the Milk Research Lab, we did a NICU study where we asked Black families about their NICU experiences, and majority shared that no one discussed the possibility or the option of donor human milk with them. And that is something that they would have liked to have discussed or even known about until after their infants were discharged from the NICU. And so, and myself and colleagues on a paper led by Dr. Anjali Palmquist, we found that there were inequities as it pertained to access to and the utilization of donor human milk at a large medical facility in North Carolina. And so we know, unfortunately, that there are inequities as it pertains to who is getting access, who is being told or informed about donor human milk. And so we definitely need to improve that, whether it is educating those in the NICU, but also, again, this anticipatory guidance before someone gives birth and talking to them about all the different options and possibilities as it pertains to infant feeding. I think also ensuring that there is Medi-Cal reimbursement for donor human milk. That's something we often don't discuss as well, as the cost of donor human milk. Sometimes that in and of itself can be prohibitive, even if a family wants to continue to utilizing donor human milk, that it just may not be possible post-discharge if they aren't able to get reimbursed for it or if it isn't being covered by their insurance. And so I think that is where that gap, in an important gap, is where we see milk sharing, community milk sharing happening. And it's something that was highlighted even more so during the infant formula shortage last year. We saw communities coming together and individuals coming together to share milk that they maybe had stored with other moms or other parents and families who, because of the shortage, didn't necessarily have access to the formula that they needed. We saw individuals relactating so that they could continue to provide human milk to their infants and or share with others as well. And so it's important that we're talking about all the different ways in which individuals and families are feeding their infants, in addition to also including formula. Again, as you mentioned, we know for a number of different reasons, whether it's a medical condition for the birthing person and or the infant, there may be low milk production, and there just may not be a desire to want to provide human milk to the infant. Those individuals and families still need access to high quality formula and safe formula as well. And they also need support in knowing how to properly feed formula to their infants. And so to make sure that they're not underfeeding or overfeeding their infants is really important as well. And so when I think of the importance of infant feeding education, definitely, there's always a focus on human milk feeding and lactation, which is important, but we also need to make space for those who are pumping, because we know there's a number of individuals who exclusively pump, who may not bring an infant to their breast or chest, and to your point in regard to latching and things of that nature. But there's also folks who are utilizing donor human milk and doing community milk sharing. And then there are those who are either combination feeding, using a combination of human milk and formula, in addition to exclusively formula feeding. And so we definitely need to make space for all of those types of feeding, and knowing that each infant feeding journey and each experience with a child is different. Someone may have had challenges and difficulty with their first infant and thus primarily formula fed, but the second child that they had, they may have had more support, more education, and may be able to exclusively breastfeed. And so we just need to be able to prepare, we need to be able to provide proper education, resources, and also making space for journeys to look different and to be different, and provide the resources and care for the individuals and families as they are.
Yeah. One big question that a lot of people have is, the question of, where do I find a lactation consultant? Where do I find an IBCLC, right? What are your thoughts on community lactation educators? I know for a lot of doulas, they do have, while they may be lay persons, they do have some sort of education in terms of lactation to some basic degree. And when we think about rural areas, for examples, areas where infrastructure may be lacking and therefore access to technology could potentially be limited, what are your thoughts on, having more of this type of boots on the ground activity as far as community lactation educators when we cannot have the IBCLCs? And how do you think that we can kind of forge ahead, nationally to help improve this?
Yeah, I think investing in programs like WIC at the federal level, more than 50% of infants born in the US, their families utilize WIC. And so WIC is an important resource as it pertains to infant feeding. It isn't only the place where individuals and families can go to receive formula. They have a very robust human milk feeding and lactation education components. They also have lactation consultants. They have CLCs. They also have very important breastfeeding peer counselors, because truth be told, not every individual or family needs access to an IBCLC. Sometimes it is just that emotional support and basic education that individuals need, and that can be provided by a breastfeeding peer counselor or a certified lactation educator or certified lactation counselor, right? And so ensuring that for those communities that may not have as great of access to IBCLCs, that people in the community are well educated and well versed and well able to support human milk feeding and lactation is really, really critical. I think lifting up organizations like MU here in the Bay, a more excellent way. Quarterly, they do an amazing breastfeeding peer counselor training, which is free to community. Pre-pandemic, it was like an in-person type of training. Since the pandemic, they have been doing it virtually and drawing like hundreds of folks throughout the country. And I think also internationally, I think they've had some folks from Canada join as well, who are, as you said, community folks who want to learn more about human milk feeding and lactation so they can better support the people in their families and in their communities. And we need more of that, right? Really building the knowledge and the resources in communities so that those folks can better support families and individuals. But with that said, we also need to increase the number of racially minoritized, Black, Latinx, Indigenous, Asian and Pacific Islander IBCLCs here as well, right? And so while we also need that community support, we also need to increase the number of IBCLCs that are available as well.
Absolutely.
And so thinking, oh, sorry.
Oh, no, go ahead.
No, so I think WIC is an important resource. I think also investing in community-based organizations such as Rose, who are doing that all boots on the ground type of work, going to the communities, doing the Rose Transformer education trainings to really get that knowledge out into the communities, I think is really important as well. And so supporting federal programs and state programs such as WIC, such as home visiting programs and public health nursing type programs, but also making sure that those community-based organizations that are doing the hard work and continue to do the hard work, those folks are also supported financially to continue to be able to do the work that they're doing and sustaining and maintaining the health in their communities.
Mm-hmm. I love that. In our post-COVID era, you know, we've gone through so much in the last few years. What are you finding, if anything, are some major changes or some major things that we need to address now or continue to need to address?
One, I don't know that we're post-COVID, right? I know, and I feel that the urgency for us to kind of move post-COVID, but you know, we have these resurgences that remind us that we're not post-COVID. I think COVID is probably going to be with us for some time, and so we need to. Oh, that's a whole other discussion in terms of what we need to and should be doing in terms of trying to help mitigate the spread of COVID during these different types of surges. But I think some of the workarounds or some of the interventions that have come out of this time that I think are really important that should and need to continue is telehealth, right? Telelactation. We've seen it just be a really important tool to be able to engage folks who may not have access to get to an in-person appointment, or because of various reasons shouldn't be in person and could really benefit, but still benefit from engagement with a lactation support person or a healthcare provider. But with the implementation of telehealth, I think to a point you had raised earlier, not everyone has access to Wi-Fi or broadband or devices. So making sure that we're doing assessments to see if people need hotspots, if they need devices, that they can engage with telehealth, I think is really important, because yes, always being in person is helpful to be able to see things like latch, to be able to weigh and things of that nature. But sometimes just communicating remotely can also be helpful to help solving issues or challenges that folks are going through. So I think that is something to think about, and hopefully we'll continue to see investments in telehealth. I think also something that I've really enjoyed seeing are the community baby showers that have happened, and the way in which people have been innovative in doing them during the pandemic, remotely, kind of like the drive-through baby showers. I love those. Where, you know, you're protecting the folks who are volunteering at the baby shower, but also the pregnant and birthing people and their families as well. But they're still able to engage, they're still able to receive the resources that they need. And it's just, and also building a sense of community, right? So they know where resources are and things of that nature. I've really loved the ways in which folks have been showing up for their communities, even during very challenging times, and the ways in which folks have been really innovative in doing so, I think is really important. I think also group prenatal care, again, not necessarily something that was new during the pandemic, but we've definitely seen a transition to more group models of prenatal and postpartum care, and we know how important that is in terms of the sense of community, in terms of helping individuals really understand their rights, what to look out for in terms of treatment, biased care, things of that nature. I think the increased utilization of doulas and midwives has also been really important. Not again a product of the pandemic, more so I think in terms of our 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 charge to really address maternal mortality and morbidity, which unfortunately has been exacerbated during the pandemic, but seeing an increase in interest of midwifery models of care, doula care, but also with that wanting to also see an increase in lactation care as well.
And I think just to wrap up, I mean, you were dropping so many gems and you know, making us aware of so many different things. And so for those of you who are listening, I really want you to take in all of this information. Those of you who are in communities doing the work, like, think of how you can incorporate some of these things. Think of who you can collaborate with, because at the end of the day, that collaboration is what helps to, you know, keep getting us ahead and keep moving us further along. If you could wave a magic wand and you could see anything, any change in maternal health, in human milk feeding, what would it be, or what would those things be that you would like to see transform the most?
So many things. I think one of the major things I would love to see is full expansion of ACA across the United States. We've definitely seen the impact of having greater access to the services provided and covered through ACA, and how that has impacted maternal and infant health. I think expanding Medicaid, here in California, we call it Medi-Cal, and we have expanded it past 12 to up to 12 months postpartum. I would love to see that happen nationally. We know that ensuring that postpartum people have access to their insurance so they can continue to get follow-up care that they need, both for physical but also mental health services, is critical to their health and well-being, in addition to that of their infants and families. I think if we could get full reimbursement for lactation support providers, I would also love to see that. Often not discussed is the important role of lactation as a strategy to address maternal mortality and morbidity. And so I think increasing opportunities for lactation support persons to be able to provide those services to ensure that individuals and families are able to meet their infant feeding goals is critical, because we know the health benefits, both in the short term, but also in the long term for the lactating person and their infant. And so I would love to see greater reimbursement for lactation individuals. And I think too, just greater investment in Black maternal health researchers and organizations that are doing this work, in addition to in Black-led organizations and racially minoritized-led organizations that are doing this work, that are based in communities. I would love to see greater investment and real investment, not 1 or 2 years of funding, but true like 5 to 10 years type of investments where folks can really just dig down and do the work and not have to continue to worry about where the next set of grants or funding is going to come from. They can really invest in their communities and do the work. Clearly I have so many goals. I have so many dreams,
love
so
that.
many things.
But you know,
that
just shows that just shows that we still have so much work to do, and we still
we
have
have
a
a lot of
ways
work
to
to
go.
do.
You know, and I
We've
and I
made
love
some progress. We've
Mhm.
made a lot of we've made some good progress, but we still have so much work to do. So I really appreciate the work of all the different organizations, the maternal and child health organizations, but also the reproductive health and reproductive justice organizations that have really been paving the way and doing the really challenging work over the last 5 to 10 years, Rose being one of them, Sister Song, Black Mamas Matter Alliance, so many different organizations that have just been doing really important work to address some of the inequities and disparities we've been discussing. So much more work to do. And that's why we need all hands on deck, right? This isn't a time for individualism. We really need to work collaboratively and really through partnership to address these really large systemic and structural and societal issues.
Absolutely. Oh my gosh, I could talk to you forever. I could talk to you forever about this stuff. And I really wish, my hope and my prayer, my goal is that this reaches so far and so wide, because so many people need to hear this information. And they need to have access to the professionals like yourself, and to the organizations that you've mentioned, so that we can start seeing that growth and we can start seeing that collaboration and that impact. I truly feel like we can get there. And I'm wishing and praying and hoping for the day when we can start to see these things actually manifest, and I think that's going to be so golden. So I thank you so, so much for all of the amazing work that you're doing in San Francisco and beyond. And know that you are helping so many lives. So that is such a beautiful thing. Where can people find you? Where can people reach you?
Oh, a number of ways, primarily through the Milk Research Lab. They can find us at milklab.ucsf.edu. And all of our contact information is listed there. We're also on social media platforms. So follow us on Facebook and Instagram and Twitter for more information about different research studies and different resources and toolkits that we are developing and sharing. And so definitely much more to come from the Milk Research Lab. But yeah, I didn't necessarily talk a great deal about the important work that we're doing there, but really proud of the research that we're doing there that really underpins and undergirds a lot of what I was discussing today, in addition to that of our community partners. So really excited about all the different opportunities that are happening. And one thing I didn't mention or lift up is the importance of social media. That's one thing too, I think, during the pandemic, for good or for bad, because we also know that social media was used as a mechanism to for folks to obtain support and resources, but also it was used to spread misinformation and disinformation. But I definitely love the work that I'm seeing folks do across social media to build community, especially that of Earth and Kimberly Allers and the work that she's doing there with that app and things of that nature. So so much more to do and so much more to think about, but folks can definitely follow us on social media and also check out our website as well.
Absolutely. Any new research that you guys are coming out with that we need to kind of stay tuned for?
Yes, thank you for that. We have a number of different projects that we're writing up right now. As I mentioned, the NICU study that we did, we created 2 toolkits that have been well received. A NICU toolkit for Black families that provides a great deal of resources for families, Black families that currently have an infant in the NICU, and or if you know ahead of time. Unfortunately, we know sometimes infants may need specialized care at birth. Folks can download that. We also have a toolkit for hospitals and birth centers to better support Black families in the NICU setting. So healthcare systems, birth centers can also download that. We're currently working on infographics and info and tip sheets related to our CHARM study, our contraceptive study focused on lactation, on impact of contraceptive use on lactation. And so be on the lookout for more resources and tools regarding that study. And then we have another study that we're going to be launching shortly on wanting to talk with pregnant and postpartum Black women and birthing people about the COVID-19 vaccine and their experiences with it, and the messaging around it. And so a lot of projects happening, a lot of work that we're really excited about continuing, all in the guise of really wanting to ensure that Black families have access to high quality lactation and human milk feeding, and ultimately that we're improving maternal and infant health.
And I love it. I'm excited about that. And please let me know when those things are here. I'm definitely going to be sharing those. And we will add some links to that. So as you guys are viewing this recording, we will have all of the links available so that you too can access what the Milk Research Lab is doing, and share that within your own communities, because I think that this is really, really powerful work. And I think that this is work that is going to be extremely helpful to not only, Black women, but minorities, all birthing persons. I think this is very, very quality and very crucial work. So thank you again for all the amazing work that you are doing. For those of you who are tuning in, again, please follow the Milk Research Lab and Dr. Asiodu, all the work that she is doing. Reach out if you are interested and willing to help. If there's anything that you can do and you can lend your experience, your expertise and support, please do. Because again, if you want to go, fast, go by yourself. But if we want to go far, and we definitely still got a long way to go, we need to go together. So definitely reach out and see how you can contribute as well. Thank you so much for your amazing work. And thank you for the time to really highlight that. I really do appreciate you.
No, thank you. Thank you for the invitation. This has been wonderful.
Yes. All right, everyone, until next time, we will chat soon, but we will be back with more quality information on breastfeeding and maternal health within our communities. Thank you so much and take care.